Hello. Welcome back to the David Watson podcast. Thank you very much for joining me. Today I was talking with Tom. Now, Tom is a master of acupuncture, and he and I got talking about Eastern philosophy and how medicine drifted away. And in a sense, medicine has become, we'll give you a tablet to cure you. And once upon a time, is it possible that we had a philosophy that was, why don't we practice a health system that is preventative, so there's nothing to cure? I really enjoyed talking to him. I hope you did too. Hello, welcome to the David Watson podcast. Thank you very much for joining me. How are you?
I'm doing great. You know, I'm happy to be here today.
Just for the listeners and viewers, we were just having a wonderful conversation about the idiosyncrasies of people that like to travel and people that don't, and that the UK, we begrudge anything over 30 minutes as we consider it a great inconvenience because we are a tiny country and in comparison. But so one of the things when I was looking at your website and stuff, I often like to ask, where did it start?
Yeah.
And I'm going to sort of apply the same question to yourself. But how did you get into so much of it? So
it looks like a circus, doesn't it?
Well, you do so many services, don't you? And it's like, where do you start?
So the root, all of it goes back to traditional East Asian medicine.
Right.
I'm first and foremost a licensed acupuncturist. My degrees are in, one of them, my master's is in Oriental medicine, which is a term we don't use as much anymore. And my doctorate is in acupuncture and Chinese medicine, which is, you know, kind of only singling out one country in a discipline that has thousands of years of evolution and has changed everywhere it's gone, and certainly has gotten influences from other cultures. And with that in mind, the root of all of that is, how do we restore function to the body? How do we go back, right? So even, you know, I don't know about the UK, but here functional medicine is a big buzzword, and a lot of doctors are turning to that, where, you know, we're looking at blood work a little bit differently, saying it's not just whether your blood work comes back in range, but is that optimal for you as a human being?
We're starting to go down this road.
Yeah. And those principles come straight out of East Asian medicine, right? It's, you know, the term they use is yang shen, and it's nourishing life, right? So it doesn't matter where we are in our life cycle, if we're very old or very young, but how do we have enough in the tank, if you will, to make sure we're full and vibrant throughout those stages. And I really liked that. And you know, the place is mission driven. Everyone that works there, they were hired not because they had necessarily a particular skill set, but because they understood that, like, we're there to help people.
Yeah. And
the services that sound all modern and high tech in my head still sound like traditional East Asian medicine. Yeah. How are you applying something to the body to stimulate it to do what it's supposed to do? And that's really as simple as I can break that down there, because a lot of the services sound very new and high tech. You know, we offer cryotherapy, we offer red light therapy, we offer exercise with oxygen therapy. And while those things became buzzwords and trendy here in the States, you know, maybe within the last decade and a half, they were, the research goes back, you know, in some cases 40, 50 years. And now we're at the point where the technology has become accessible. Yeah. You know, like it might be in a lab somewhere or at a university doing studies, but when you know, they're not consumer models yet in some cases, but, you know, clinical models really started to pop up. And that's kind of what excited me. It's like, look, we're solving these age-old problems of humanity, you know, our own existence and how we function or dysfunction, with some modern technology that has very traditional roots, right? So red light therapy sounds fancy. Oh, we've got these crazy panels. You lay down on a bed, you're bathed in red light. And if you were outside in the AM hours or in that sunset time, well, guess what? The sun's doing that for you.
Yeah.
Right. Our cryotherapy, we go from I'm assuming it's probably similar globally, or at least in every really area that has a lot of city areas or denser populated areas. You go from your house to your car to work, then back to the car, then maybe to the gym, and then back to the house.
Yeah.
And you're not outside in the elements anymore, so you're not getting the sunlight. You're not getting exposed to heat and cold the way we would, because we all use AC, or I don't know what you call it over there.
Yeah, no, AC is the same. Yeah, we call it air conditioning.
Okay.
AC. Yeah.
Okay.
But it is, isn't it? Because it's an interesting point, because once upon a time you would have woken up because of a sleep cycle, which would have roughly coincided with the season, the kind of the night and day cycle of the season.
Yeah.
And you most likely would have gotten up, felt cold, and moved around to warm up. Whereas we just crank on the thermostat now and have it set.
Yeah.
People have apps, so it warms up half an hour before they get up.
Yeah, and we never have to experience more than a few short seconds of anything that we might find unpleasurable or uncomfortable. Woo.
Yeah.
I'm butchering your language. I'm terribly sorry.
No, it's all right. We'll both be good at that by the time we're finished. But it is interesting. I do genuinely have a belief that one of the biggest health crises that is catching humans out is that we just don't live in our natural states anymore. Yeah.
And we've really pushed that past what anything. Yeah, there was a quote, and I'm going to butcher this one, but it says, we have primitive bodies, we have archaic societal systems, and we have godlike technology.
Yeah.
Right. So there's a disharmony there at every level. Right. We're living in systems that don't serve us, and that I don't care what anybody's political views are. I think we would all agree with that. Right. This is not the best, environment politically for anybody. We're still just advanced primates, which upsets a lot of people. But that's
what we are. Yeah.
And we have, like, literally, I got a phone sitting right in front of me that I have access to the entire world, right? Everything. And watching my kids, they can't handle the phones, and I mean, like, and they're expected to, But
because I was having this conversation with a gentleman the other day, Faust Ruggiero. I think he's a psychiatrist. He's written a series of books called Fix Yourself. And him and I were talking about the fact that in terms of evolution, our species, depending on what sort of branch of the tree you go down, we've been around for about 2 million years. And if you go down to sort of like the basics of the brain and that operating system, it's about 2 million years old. It's had some sort of, it's evolved slightly, but it hasn't evolved in the last million years or half a million years. It's still the same. If you crack open the skull of a human being and an early human, oh look, it's the same skull, it's
same stuff,
brain, same operating system.
Yeah,
and the bell curve has gone like flat, 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 and then it's just gone up in the atmosphere like a rocket. But our operating system's just like clinging on for dear life, saying, what the hell is happening? Because this is not what we evolved into.
Yeah, it is so interesting when we start to look at that way. But I also think, and this is going to sound so weird. There's these theories, right? And we have this show over here called Ancient Aliens, right?
Yeah.
And they blame every old technological advancement on, like, oh, it's got to be aliens. And it's like, no, you don't understand. We've had this brain as long as we've been called Homo sapiens.
Yeah.
So why wouldn't we, if we didn't have the distractions, why wouldn't we sit there and problem solve?
Yeah, of course.
Why wouldn't we work out these things at a level? So, who built the pyramids? Well, I believe the Egyptians did. This is not, and even it's funny because this was a footnote in one of my acupuncture textbooks. And it's so funny to mention because we attribute modern day acupuncture to the Yellow Emperor, Huang Di, right? And the textbook that we treat, and this is not a religious text, but I'm going to call it the Bible because that's kind of what we all misquote and misrepresent, which is kind of a statement on society in general. But within that, there was a footnote about this that, Huang Di could have been an alien, right? He came down from heaven on a dragon, and if you didn't, and I'm like, come on, man.
Yeah.
Come on, man. And the textbook says, look, this is clearly, a rogue theory that holds no water, but it's funny enough for us to mention it,
Well, it is, because things like this, it's interesting that people don't, we look at things backwards. In terms of, like, we look at history and we don't understand, or we don't kind of try to appreciate the point of view at the time. And an interesting one, like, because when you look at like foods, so it's well known that Muslims and Jews don't eat pork. Well, that's because years and years, thousands of years ago, pork was a dangerous meat to eat because people didn't know if you didn't cook it thoroughly.
You get trichinosis, you get a whole bunch of parasites.
It's easy for a culture of people to develop this idea that you're not meant to eat it religiously. You know what I mean? Like, our God doesn't want us to eat that. It's a bad meat. So it's not fit for human consumption, which is why they were always considered dirty animals. But it's actually a perfect example in history of the evolution of people solving a health problem. Because they hadn't figured out you're supposed to cook it properly.
But
it becomes this religious, like, you must not. And it's like that's not how it evolved. It just didn't.
Yeah. This is always a fascinating topic for me because I'm really passionate about these traditional therapies, right? I wrote a book on cupping because we have some evidence there that, like, look, we got plenty of modern research. We have several thousand years of clinical practice and practice in people's homes. And it always stuns me that, like, we look now, right? And I'm assuming every era probably did this, where it's like, oh, we're at the apex of our knowledge. Like, we know more than they ever did. Look at the technology we have. And I'm sure, if we go back to ancient Rome or ancient Greece or, one of these Renaissance periods or something like that, the theory is probably the same. Oh God, look at the time we live in. Look at the technology we have. And it's almost like that ignorance of humanity, right? Like, other people couldn't have thought this, and we're just building on technology that was already there. And yes, that goes exponentially fast, but the way our brains process it is pretty much the same. Well,
it's interesting because have you ever seen those videos where they're normally like TikTok or YouTube Reels or something, and you get a bunch of modern kids on an old telephone and the parents film it and they don't know how to dial a phone. Now, they look at that like this is crazy simple, right? But that was the apex of technology when it came out
at the time,
right? And but the technology's evolved so far that people can't figure out how to work. Basically, it's the calculator to the abacus, and I wonder how many kids could use an abacus.
Well, that's a great point. And on the same token, like, what's the need to, right? Yeah. Why would I continue to carry that knowledge if it doesn't serve me in the society I'm living in? So it's this double-edged sword, right? Because like, I don't know how to work a loom, but that was. That was very important for a culture at a time.
But there are people, but everything is still roughly on a loom.
Yeah, it is. Now it's high tech and it's run by computers, and
no one's sticking their hand between the needle.
No one's sitting there with a shuttle going in between the threads. But within that, it's you even have this niche. There's only so many people that probably know how to repair them. There's so many people that know how to run them. And our society still depends on that, so we can, have clothes.
How then? Because that's a really good point. Because everything you've mentioned there, the reason you can forget what was before was because it's been improved upon.
Mm-hmm.
But there's a valid argument that hasn't happened with medicine. So why did people stop a practice that was serving them so well?
So it's God, we can get into the evils of modern medicine and the healthcare system as a whole.
Money.
I think absolutely, and to hear somebody from a country that has socialized medicine say that, it's still very interesting to me, because
I tell you now, people go on about the NHS. It's not the service people want to believe it is.
Yeah, but this is, you hit the nail on the head there, where I think when we have a profit-driven model of any kind, people suffer.
Yeah.
And the reason a lot of these traditional practices fell out of favor was not because they weren't clinically effective. It's because somebody couldn't sell a drug or a new procedure, or in our case, we can't bill insurance for that.
Yeah.
Right? There's no way for us to get paid for it.
Where I should defend the NHS, to be fair, is if I drove down the road today and had an accident, the ambulance that collects me is going to be there within 10 minutes. It's going to be free. I'm not paying for anything. Yeah. And by as quick as it takes, I'll be taken into surgery.
And I think you're even touching on another issue that I think is very important. When we look at modern medicine, the emergency aspect,
the NHS emergency access
is the best part of it, right? If you need critical care,
it's world class. It's world class.
Yeah, and here it's more of access to that, right? If you don't want the ambulance picking you up, going, "Hey, what insurance company do you have?"
That's it. So here, it doesn't matter what tier of society you're on. If you need emergency medical care,
you're getting it.
You are getting it, and it's a world class service. It really is.
Yeah.
Where we falter, which is the same as any country, is, and this could be argued, how much of it do we really need now? Because for people that don't know, the NHS was set up in 1953 because there was no health care for working class people. And after the war, and with monies and troubles, people realised it was only the middle classes that had access to healthcare
to anything,
because they could afford to pay for it. And middle classes and above. So we created the National Health Service. But it was designed to be medical care. And of course, the thing about medical care in 1953 versus 2024, you wouldn't even recognise the hospital wards anymore. And slowly, people don't realise this, but the NHS actually has become more and more privatised. It's kind of privatised through the back door because they have private contractors coming in doing everything now. But it's still the NHS.
And even with our privatized healthcare system, here, I feel like a lot of the profit-driven stuff just got worse and worse. It got more ratcheted up. So making that divide even better or deeper, not better, clearly far worse. Where like a lot of middle-class people here don't even have health insurance.
Yeah. I mean, like I said, if you had a heart attack, the ambulance is going to be there in 10 or 15 minutes. Yeah. If you, I don't remember what the number is, but it increases every day the amount of defibrillators in public spaces, so that if somebody does have a heart attack, there's a defibrillator for anybody to use. Yeah. Right. Yeah. So we do some huge, amazing things like that.
And that's great.
If you got diagnosed with cancer, you're probably going to see the specialist within 14 days, and you'll probably start your chemo treatment within 28.
Amazing. I had a patient that she didn't have insurance, and she came in once. She said, "Look, they found a lump in my breast, and I don't have insurance, and I don't know if I'm going to even be able to afford the follow-up." Now, she had a history of no showing. I had taken her as a hardship case, so I was reducing my rate for her. and she owed me for a couple of treatments. I said, just don't worry about it, just come in. She didn't show up for one appointment, and I was like, all right, this is it. And I left a message saying, look, I'm trying to work with you. I want to take care of you. I understand you have a lot of health concerns, but I'm doing my part. I need you to show up. And she never responded. And 3 weeks later, one of my staff members mentioned that she had heard that she had passed away without any care, so she probably was in a very dark, horrible place when that happened. And it was a failure of our system. And this is somebody that needed a critical intervention. If you need something cut out and you need something killed, modern medicine is the way to go. When we talk about what is life affirming, what's going to help you function better, what is well care, what is preventative, you need to start looking more at the traditional practices, right? So
preventative is probably the key word, though, isn't it?
Yeah.
It's like this is a great lifestyle to prevent poor health in the future. It's almost like
and that's really what we need.
Plan.
Yeah, and investing now, and it's hard. One of my passions is meditation, and it took years and years and years and years. I would say probably about 20 before it actually stuck for me, right? Where I'd go on these patches where I'd meditate daily, and then I'd break the cycle, and then I meditate. But you couldn't tell a 20-something-year-old me that meditation would have such the benefit it does. And now at 40-something, I'm going, no, I see the benefit. And had I had the mindset when I was in the 20s, I probably would be, I guess you don't want to judge your meditations, but I would be further along now. I would be, I developed those neural pathways that we see from long-term meditators. So all of these things come into that well-care kind of environment, right? It's the food we eat, it's how we move our bodies, it's the thoughts we have, right? And medicine, at least from a modern Western perspective, doesn't really take into account, right? We put mental health in a different box, we put dentistry in a different box, right? We put pregnant women in a sick box. That's a condition, well, here at least, actually.
Right? No, we do the same here. I've never thought about it like that.
And we're talking about natural processes. I had a dentist joke with me at some point. The medical system decided the teeth weren't part of the body. And we know if people have inflamed gums, if they have bleeding gums and these kind of things, they're more prone to heart conditions.
We do know that.
So it's like, how do you understand? And this is a fundamental thing in East Asian medicine where like it all talks to each other. It's all connected.
That's a good point, actually, because I kept having this reoccurring toothache. I kept having this reoccurring. It was a toothache. And I can't remember what the problem was, but it was my dentist, not the doctor, that figured out. No, you have a nasal infection.
Yeah.
He said you have a recurring nasal infection and it's pressing down on the nerve in your tooth. But when I went to the doctors, they were like, "No, that's not how it works." And and I went back to the dentist, and he just said, like, he treated me with some antibiotics, which he shouldn't, which was in his remit to do, but not for a toothache. He gave me antibiotics for a nose infection,
sinus infection. Yeah. It is so funny to me because that is. When we need the reductionist model, right? We need to say this is the smallest. Oh, this atom is wrong. How do we fix that? Right? That helps improve outcomes. But unless we have that bird's eye view where we can see how everything's interacting, we're talking, a centimeter, 2 centimeters apart, and it's completely missed.
Well, I have interesting personal experience because I'm a hypnotherapist as well.
Yeah. Oh, wow, that's amazing.
And I do a fair bit of work with people that have autoimmune diseases. And it came about as a coincidence. It's just pure coincidence. So I work in head injury rehabilitation is my main role, and I run a care team around that. And I have sort of like the podcast like yourself as well. And I do hypnosis sort of part time. And I was talking to a friend of mine who has since. She'd be in mid-30s now, I think. If I've got that wrong, I'll apologise to her. Maybe I won't, but she'd had a celiac condition since she was 13.
Yeah.
And which is effectively an autoimmune disease.
Yes.
And had been hospitalised with it, seen specialists, being pumped with drugs for it. And I was just talking to her about something one day random, and I just noticed she was getting anxious. And I was just like, I can fix that. And she was like, I said, you're anxious. I can fix that. I know how to stop that anxiety that builds up. And I started working with her, and she's been symptom free for 2 years. And I've done the same with people with fibromyalgia and stuff like that. But the thing that always fascinated me is she still has to check in with a specialist because she's had this disease for so long. And even though her blood works have come back, like no flare-ups, no problems, no nothing. And he was like, yeah, this is great, blah, blah, blah. She went, yeah, I've been seeing this hypnotherapist. I see him roughly every 4 weeks, and this is what he does. And she said he just shrugged his shoulders and went, oh, that's nice.
Well, you know, if they don't understand it, if they don't measure it, right? You know, I mean, even my profession, it's so funny that like the view of my profession since I started to now. I mean, I had somebody saying, I had a medical doctor tell a patient that I was going to end up giving them hepatitis because I might not have clean needles. And, you know, I was like 20 years before I was licensed, we were only using disposable needles. So, you know, and now, like I recently gave a lecture to med students. Why? Because the younger medical professionals know this works. After COVID, when we were allowed to open back up, the first people in my office were Western doctors and nurses and nurse practitioners and physicians assistants. Why? Well, one, they were seeing some horrible stuff in the hospitals, but two, they knew that like they needed to put something back in their own tank before they were able to help people. And for me, you're hitting on one of the fundamental things as a hypnotist of Chinese medicine. That Yellow Emperor's Internal Classics that I mentioned before, that textbook says the root of all disease is first in the spirit, right? So how do we tap into that? You know, and we can't access that by cutting it open and going, here's the spirit, you know, let's fix this.
I mean, all I do, and here's, now I'm open for anyone debating me on this because I figured this out for myself. So God knows what pitfalls I've missed, right?
Yeah.
So I have this scale at 1 to 10 is what the human body, 10 being the maximum amount of stress the human body can take before it starts developing symptoms. So you'll be like, yeah, well, I'm easily at 20. No, you got to 10, and then the body's like, if this carries on, we're going to display symptoms, some form of physical symptom.
Yeah.
Now, the bit that I'm not certain of, and I've never explored it because I don't feel it relevant to what I achieve, is did you already have the condition and this has made it flare up and exacerbate it? You know, like, is it just it's part of your DNA? You were born with this, and if life had treated you completely different, you'd never be aware of it. Or do you have the condition as a result of the stress? It's like, you know, is it the chicken or the egg? And my answer is I don't know. What I do know is that under hypnosis, I can get you to release all of the physical and emotional stress in your body. And it's just as simple as getting you to imagine that stress is all of your stress, and everything in your stress is just a dirty, disgusting liquid in a sink. And if you pull the plug out and it just drains away, and then you clean it, and I get you to feel it as though it's draining away from you, they always, you know, and there's a couple of things like, if there's anything you haven't said that you wanted to say and you feel angry, and I get them in this hypnotic world to imagine shouting and screaming everything they've ever said, so they just release it. And it's literally mind, body, spirit. It's as simple as it is old. And then I get them to imagine, just like, scan their bodies. Can you feel any tension anywhere, any uneasiness, you know? And if I know there's a particular condition, can you picture that for me? And they'll describe it for you. Well, then I get them to describe it in a perfect way, because if it's like, say, it's something in their stomach, they always describe it as knots. Do you know what I mean? So if I can't get them to untangle it, then I'll get them to make the image blank, so there are no knots. Do you know what I mean? It's all just working with that subconscious. And they 100% every time they feel better. However,
I can't.
It's not permanent. The longest I've known anyone go before symptoms start coming back is 6 weeks. But they also all have stressful lives.
Yeah.
And it starts with you get up in the morning, stub your toe. You then drive down the road to do some shopping, you can't find a parking space, or somebody cuts you up, or you're caught in a traffic jam. By the time you go to bed, you're at 8. And your body's only going to give you 2 more points, and you wake up tomorrow and you're at 6. Well, yesterday you were 8, and today you're at 6, so you're going to go 4 over your 10 when you wake up. You know what I mean? And it's just like...
Yeah. Just even getting out of bed is... Yeah.
And so that's... But why it works, I couldn't tell you as such. You know, I understand it on a level, but not on a deep level.
Well, God, there's so much in that, and you know, David, it's interesting because before we hopped on this call, I was thinking about this, like let's call it this mental health care crisis we're all having, and if we look at indigenous societies or traditional groups, right? That falls right into that role of the shaman, the medicine man, the healer in the village, and their ceremonies, their customs, whether or not they're doing what they say they're doing, what they're doing is they're reprogramming people's brains, right? And we know from a modern standpoint, I read this brilliant book on epigenetics, right? So we have our genetic code and our genes are whatever they are, but these little things that hang off that code can be turned on and off depending on the stress and the stimuli, right? So in a lot of ways, we actually are reprogramming not just our psycho-emotional bodies, but our physical body as well. And we're not... we always want a number associated with it for science, right? We're not at the standpoint where we can do that yet, but it doesn't discredit what is being done, one, by traditional therapies, by shamans, by people that are considered in alternative medicine. And part of that human condition, part of that consciousness that we have that we still don't know what it is, right? Is it local? Well, it's in our whole body. It's not just sitting up here in our brain. And it's non-local in some cases. There's all these crazy stories about that kind of stuff. It responds to subtle changes that sound crazy. So like when you're telling me this is happening with hypnosis, I'm like, look, this is like some pre-Taoist ceremonies that we talk about in Chinese medicine, where it's like, no, these things were kind of thrown to the wayside as we got more intelligent, as we got more structured, as we knew more about the human body. But there was that separation, right? This ghost in the machine thing in East Asian medicine. It's not a ghost, it's not a machine, it's a continuum, right? The energy just gets denser and denser until it manifests into a physical body. And when we have these, like, so it's just the depth. What depth are you at?
Well, it's interesting because, especially in the 80s when I was growing up, I was born in the 70s, but in the 80s,
me too. Yeah,
is everything was the yin yang, and everyone was like masculine and feminine, and it's just like, but it meant more than that. It meant it literally, although it's masculine and feminine, what it's visually demonstrating is, if you have one without the other, it's out of balance.
Yeah.
And the two work in harmony. Well, that's physical and emotional. Yeah. It's body and spirit. It's mind and body. It's all of those things. And like with the hypnosis, I think one of the things that the reasons it works is because I can also make them feel in 5 minutes like they've had 8 hours sleep. So their body wakes up like they've been asleep for 8 hours because I've told them they have, and they believe it, and because that's the way hypnosis works, sort of thing. But they physically feel it. And when I think about the things that I think about when we go, I always look at where we're from, what's our origins. And like you said at the beginning, we're primates. It's as simple as that. It's not we've complicated it, but we're still a primate. And once upon a time, we were running around the savannah, either chasing something or being chased. And there is some research into people that get anxious or stressed or depressed to do sprint sessions 2 or 3 times a week because it just dumps all the adrenaline out of your body. But you've got to really exhaust yourself as if you were being chased. And you've kind of almost got to imagine you're being chased and like sprint for 400 meters, for like a minute plus, as fast as you can, and do that 3 or 4 times, like in one session, 2 or 3 times a week, because it tells the body just, we're done, we're good. And of course they then go away relaxed. And I think, like you were saying, and like I saw with all of your services, there's so many things that are working in harmony with each other as complementary services. And I think that's, like you're saying, it was that point where medicine has gone off in a separate direction. And it's like, no, we have to pull this back into that. Maybe there needs to be 2 or 3 services on offer every time you treat somebody.
Yeah, and you hit something, and I use an analogy of a gazelle all the time in the office, right? And it's like that gazelle is getting chased by a pride of lions, and when it's over, if it gets away, it isn't carrying that the rest of the time. It isn't going, oh my God, did you guys see that? I nearly got to eat. Oh my God, what's going to happen? I can't go back over that. No, it's at the watering hole drinking, it's eating, it's pooping, it's mating, it's doing the parasympathetic side. And when we look at acupuncture, we talk about qi and all these concepts that make, Westerners' eyes glaze over. What they were describing, above all else, was regulation of the autonomic nervous system, fight or flight, rest and digest. What happens when we're stuck in fight or flight? We ratchet up, we get autoimmune disorders, we get pain, we get lack of blood flow to tissue, and that tissue can't perform, right? And then we say, the qi's stuck or the qi's deficient. But when we start to regulate that, when we switch you out of the fight or flight, and this is one of the reasons, like the best thing about acupuncture, and people can fight me on this, is giving that person that space to switch that, knob, and turning them into that rest and digest. And a lot of times, you're going in, you're checking on them, you move some needles around. By 30 minutes into that session, they're snoring, they're gone. And that's where the magic happens, right? That's like, we're trying to reprogram their psychology through using their body, right? So these are all tricks, right? And I've heard stories even with hypnosis where they can prick the fingers, right?
Yeah, you can.
And say, please make this one bleed, not the others. And people can do it, right? So the control that we think that is like, well, no, there's a hole there. The blood vessel's broken. It has to bleed. Yeah. No, there's something that we can tap into about control of our body that is so amazing, and it why? Because they're intertwined. It's not here's the pilot in the plane, right? It's the pilot is the plane is the pilot, and that's such a crazy thing. But when we pull back and go,
it's like you were saying about the acupuncture sessions where they literally just crash out. What I do in my hypnosis sessions, I take them to this place called the world's most comfortable, cuddly, snuggly chair. And they just, like literally, I just get them to sleep in the world's most comfortable, cuddly, snuggly chair. Because it just sounds like somewhere you'd want to sleep. And I swear, I think all I'm doing is resting them, is getting their body to just, right, I'm in the world's most comfortable, cuddly, snuggly chair. This is where you relax. Because that's what I'm telling you to do, just relax deeply. And just drift and let go. And everybody subconsciously, that nervous system just says, oh, right, okay, I'll stop then. And, like you do with acupuncture, the nervous system just says, oh, no, we're good. We can switch everything off. And because everything's switched off, everyone just goes, oh, thank fuck for that.
Yeah.
And the whole body's just like, do not disturb me. I'm good. Come back tomorrow. And I think it's just that. It's just simple reset and rest. Well, we don't do that,
no, and we the term paper tigers comes to mind, right? Where oh God, I'm at work. My boss is going to kill me if I don't get this done. Well, is your boss really going to kill you? No. Does your brain think he is?
Yes. That's it in a nutshell. Is because this is I try and explain to clients sometimes that we get so wound up in our imagination about what's happening that when we then don't physically react to what the stimulus we're giving our emotions, it is going to get paranoid and anxious when you're just trying to buy milk in a shop. And that's why you have a panic attack, because your body is just like, well, something's going on, because you're really worried about something, and I can't see the danger, and I can't figure out what the danger is. So maybe the danger is that random guy who's also shopping for milk. So I'm just going to react to it.
Yeah.
And it's trying to tell you, stop. Will you just stop? You know, like, seriously, go and run. Go and, you know, do acupuncture. Go and just do something where you'll just let me rest and shut down.
Yeah, you know, it's so funny because the extreme version of all of this, and it's so funny, is probably the wrong term, but the extreme version of this is PTSD, right? You were in a life or death situation at some point, and now your body and mind will not let you step away from that. There is no comfort. There is no zone, right? We see a lot of vets in our office, and we had a story where, like, one nearly snapped at my front desk person. Yeah. And it wasn't, she did nothing wrong, but this person was already in fight or flight, stuck in fight or flight, saw her as a threat, and kind of got a little weird there.
Have you seen the studies with special forces? Because they don't tend, it's not exclusive, but they don't have as much PTSD.
I would see, I could understand that. I haven't seen the studies, but I can understand that they've actually...
Yeah, Jocko Willink has spoken about it as well, and his theory on it is, he said, because we literally don't go on patrol. He said, we're not constantly scanning for anything. He says, we get given a mission. So we turn on for the mission, and then we go out, we complete an objective, and then come back, and it's like, right, stand down. He said, the average soldier, they're going out on patrols. They're coming back. They're going out on patrol. And they're always scanning for danger with no objective. In the same way as he says, we might plan a mission over 3 or 4 days, execute the mission, come back, do a debrief, and everybody knows it's done, because that's what our training is. Whereas,
and they're literally turning off that adrenaline response.
Whereas the infantry guy knows he's going out every day for the next 180 days. He's just we're just
doesn't know any details past that.
We're just stood down. He said, and when we're going out, we have a fixed objective. This is where we're going. This is what we're targeting. This is what we're doing. So it's on, and then we turn it off.
Yeah.
And
that's interesting. I mean, that makes sense, and certainly I'm assuming some of their programming, and I'm saying that in their training, they're programming themselves to do that. Yeah. Right. Look, this is going to be hell for this amount of time, and then it's not.
And I think that's the other thing in it. All of them, regardless of what special forces it is, cognitively and emotionally can push themselves where, their idea of what a comfort zone is, like, I might push myself as hard as I think I possibly can. You can be shouting and bawling at me to get an extra 10%, and one of the the guys from the SAS or the Navy SEALs will be coming past in their slipper and dressing gown saying, you're still in the comfort zone, buddy. I'll be like, no, I think I'm dying.
I think that, and that's probably why the training is so rigorous too, to select those traits, those attributes that they need for that, right? It also strikes me funny, right? We talk about it here, where, like, they'll get the, for the frontline infantry, regardless of what branch, it tends to be inner city, it tends to be undereducated, it tends to be the people without the opportunities. They're already ratcheted up, right? I mean, their whole life has been stress. Yeah. And then for the elite people, they tend to be better educated. They tend to, they have a different mindset, right? Yeah. They were created differently, and then they're further weeded out in those programs. It is such. It speaks to that human condition, right? How can we turn that on and off? And I don't think every one of us is going to be a special forces kind of guy. I'm certainly not. I'm kind of anti-military all across. Like, how about we don't kill anybody? Yeah.
How did you get into all of this?
Everyone asks that. It's such a weird story that it almost is like I didn't have control over it. So I grew up thinking I was going to be a medical doctor. And a few events that had happened in my life, and I was talking about my grandfather. My grandfather was a pharmacist, and he worked in an area that had a lot of Latinos that had, whether or not they were legal, they were mostly doing day labor. So here they go outside of the Home Depot, the construction store, and hop in the back of a truck. They work for the day. Somebody hands them money, and my grandfather, us being Italian, the stereotypes about Italians when they first came over was very similar to Latinos, where he would always call the Latinos his people's people, right? Yeah. Largely Christian, Catholic, large families, strong work ethic, and they knew that they were going to be doing the shit jobs, to put it bluntly. So my grandfather was counting out pills one day, and it was for a day laborer. And he goes, these pills are $5 a piece. And this is in 94. And he goes, this guy's going to take 3 a day, every day for the rest of his life. Do you know how much that hurts his family?
Yeah.
And he said to me, there's got to be a better way, and I'm hoping you find it. And that kind of got stored in the back of my brain. My grandfather died probably a year or two later, and it was super traumatic for me. I kind of hid it away. I was in college in my pre-med classes, and I had some experiences in our healthcare system where I booked an appointment with somebody. I had to be at a job at 11. I took the 8 a.m. appointment. I show up at 8 a.m. There's a waiting room already full of people. The doctor is not there. When are they going to start taking people? Oh, well, she's in surgery. She won't be here until like 11:30. And I said, but I had an 8 a.m. appointment. So I'm leaving. Well, no, you're not going to wait for her? No, I'm not going to wait 3 hours for an appointment that's supposed to start, 10 minutes ago, and with 12 other people in the waiting room. It was disenfranchising. I also had an appointment for an allergist, and the guy's like, all right, we're going to start allergy shots. I'm like, you didn't even talk to me about options. This was just, this is I'm late teens, early 20s, and this is throwing me off. I was at a school that was a liberal arts college, taking, my core biosciences, which were the pre-med programs, but I took a Chinese philosophy course. I liked this concept of balance, right? And the great thing about a lot of the Chinese philosophies is they bleed over into other aspects. Clearly, it's in the medicine. Clearly, it's in their artwork. It's in their writing. It's in their calligraphy. All of it has to be balanced. All of it has to pay attention to the 5 elements, the 8 directions, all these classical concepts. And I took a Tai Chi class as like a club after school thing. Through a bunch of weird acts, my financial aid package changed at college, which is another thing we have over here. Private universities that cost a lot and don't give you a path to a career that can pay off those loans.
The UK so is the same in that respect.
I transferred schools to a technical school, and it was associated with an osteopathic college. So I'll be a DO, not an MD. No big deal. Right? They're interchangeable here. And that winter intersession, I got a postcard in the mail from an acupuncture school having an open house. I went to the open house and I was enrolled 2 weeks later. I skipped my senior year of college because they were going to give me a bachelor's in professional health science, and the master's in oriental medicine. And I flourished there. I had such a fun time. The concepts are circular. They're not really well defined. But when you let go of the linear thinking and you kind of immerse yourself in it, you figure out a way. And I never look back. It was just brilliant to me. It was life affirming. It was the exact opposite of what my experience was going to doctors, where somebody's going to listen to you for a while before they do a damn thing. Yeah. And then they're going to talk to you about the process. They're going to tell you what they're going to do. And if you say, hey, I don't like that, they have another avenue. Like this, okay, we don't have to do that. We can do this. Right. So really respecting the patient. Right now, the buzz term is evidence-based medicine. Right. So everyone thinks, oh, it's got to be double-blind, placebo-controlled, gold standard RCTs, randomized controlled trials. Well, yes, that's part of it. Right. The research is part of it. But when we talk about true evidence-based medicine, it's what is the practitioner's experience? What do they know? How do they approach this? And then equally important to those other two aspects is what are the patient's wants and desires, right? I was having this discussion with one of my associates. He's of the Muslim faith, right? So we were talking about these different ways of approaching different patients based on where they're coming from, right? So, hey, look, evil energy, dark forces are a big thing in the Muslim religion. So we need to, like, if somebody comes in and say, hey, I feel like somebody put this curse on me, we don't belittle that. We go, okay, well, I'm going to try and do something to release that. Right. And we're doing it from our framework, from our mindset, but we're not devaluing what they say and go, oh, that's all bullshit. Or, oh, come on, I'm an atheist. That's not real.
That's interesting, because in NLP and hypnosis, because NLP is a huge part of hypnosis, if somebody says to you, oh, I feel this, that's the road you'll go down, because you'll mirror their language. Yeah. So, and it's like you said, it's going back to that thing you said at the beginning about how they took medicine down this road that's purely in textbooks. And yet all of these other industries sort of thrive and sort of almost intertwined with each other with their understanding of how the body and emotions work. Yeah. And in our own ways, we all get great results. Like you're saying, if I was talking to somebody that was using like religious, was talking about religious feelings or evils, or I would go down that road, because I got to get comfortable, to get them to subconsciously be comfortable with me, I have to mirror their language. And it's just a given. We don't even question it. We're like, well, if I don't do that, I know it won't work. So it's not about me convincing them to trust, to be me. It's about me getting their trust by understanding them. So,
you're meeting them where they need you to meet them.
So every single person that I speak to, every single client, is treated differently. Regardless of what the symptoms are. It doesn't matter if they're in there for a sleep clinic or trying to lose weight. I have to speak to all of them differently. And we don't do anything from the textbook.
Yeah. It's funny for us where we actually we have more RCTs, we have more systematic reviews. So I'm talking Western science-backed studies than physical therapy, which comes from Western medicine. And the bulk majority of those were trying to disprove and discredit Chinese medicine and acupuncture. Now, the crazy thing is they all show positive. The bulk majority show some positive effect, right? But they're standardizing these protocols. Yeah. And when you read them, you go, well, I would never do that on a patient that came in like that. And it might be a study on something as like, let's say, global as low back pain. 80% of the population is going to have low back pain. We never treat it the same. No, right? No. Why do the same thing? That's a different person on that table.
I had a client who was seeing me for something completely different, and I was talking to them, and they happened to mention that they had back pain, and they were going to make an appointment to see a chiropractor. I was like, "How long have you been seeing a chiropractor for?" "Oh, I don't know." I was like, "But that makes no sense. You don't have an injury." I said, like, well, what is it they're fixing? What is it they're repairing? And I go to chiropractors and osteopaths myself, but it's, and she's like, oh, it's ever since I fell off a horse when I was 13. And I was like, oh right, did you break your back or something? No, I ended up in hospital, but they scanned me, everything. There was nothing wrong with me. I stayed in overnight. I was x-rayed. And I was like, oh, that's a subconscious condition. I can get rid of that. And I did. She's never had back problems again. Because I said to her, great. It's just I will caveat this, actually. The indicator was that she was having repeat therapy. And it's just like, no, if you're having repeat therapy, that's not the problem. So I should just caveat for anyone listening, the reason I was confident in what I was doing is because she'd had too many appointments over too many years with a professional chiropractor. So it's like, right, so you have an underlying condition to the one the chiropractor is fixing. And then when she told me about the traumatic experience from when she was 13, and she originally, when the ambulance was turned up, that she could hear people saying she might never walk again, and all of that. And it's just like, well, your whole body's just going to be on red alert. Every time you move your back in a certain way, your body's going to be like, oh, hang on.
Well, that's a negative NLP right there, right? It's the reverse of what we're trying to do. And she heard something and that it was internalized. Yeah,
and that's all I did was took her back to that, and then that's just reminded her, look, you saw a doctor, you went to hospital, you had X-rays, you had MRIs, your back is completely healed. You can relax. You don't need to worry about it. Yeah, and she's been fine ever since.
Yeah. And it's funny because we would talk about that as a treatment blockage, right? They're not seeing the results we would expect, and we have to do one of two things. We have to change treatment course, or we have to refer out. No, this is out of my league. This is not what we thought it was. So yes, see your chiropractor as, some kind of maintenance program. That's fine, but if you're not seeing the results, clearly you have to go in a different direction.
That's probably a better way of wording it. It's like a treatment blockage, because I've had my own experience with injuries in my back and my neck and stuff, and seeing osteopaths and chiropractors. I know there's a procedure, there's an idea that over X amount of treatments you should experience an improvement.
See some improvement. Or look, we're in the right direction. We're going in the right path.
And she'd had this for getting on nearly 20 years. It's like, no, that's not how it works. She hadn't been seeing a chiropractor, but she'd been seeing a chiropractor for about 10 years, and I think it actually moved to just giving her relief. And it's just like, no, I think I can fix that. And and I was correct. And I've often found that it's actually the most effective clients I've had are the ones that have been everywhere else. So they've seen the doctors, they've seen the specialists, they've tried the medications, and because of that, that's kind of the evidence that it's more likely subconscious. Whereas, and just for the record, I don't treat people unless I know they've been to see a medical practitioner first.
Yeah. It's God, you're talking like an acupuncturist. It is so amazing.
I don't think it's any different.
It really isn't.
I think we are working in exactly the same sphere. We're just talking to the body differently.
Yeah.
It's a different communication model.
The stimulus is almost, I don't want to say it's not important, but it's less specific than how you're getting in there, right? And what you're trying to work with, which I think is just so fascinating. I mean, God, we could translate half the stuff you said into traditional Chinese medicine concepts. Talking
to you, I'd be fascinated to know. I mean, it's not really viable for me to jump on a plane to come over and see you. But what would happen if somebody was hypnotized while and then treated at the same time?
I had a teacher who was, Guild of Hypnosis or hypnotist, whatever the term is over here, but he was certified and credentialed through that, and he was an acupuncturist as well, and he wrote his master's thesis on something that sounds even so far out there. And I'm always nervous that if I go too far out, I'll get discredited by the Western people that are coming in. But he wrote it on past life regression. So he had a whole protocol for acupuncture with past life regression. And it's one of these things where in my head, I read a book on neurotheology, which was written by this guy in Canada. And he's like, look, there are these physical changes in the brain that happen when people think they hear God, or they're getting visions, or so there is something physical happening. Now, whether or not that's actually happening in reality, well, it's happening in their brain, so it's real to them. So we can't take that away. So even if past life is all BS, they're experiencing it, and it's a very real experience. And being able to tap into that to cure something has tremendous value, right? So I don't even need to judge whether or not it's real, because it's real to them. It's important to them. And if I address it, as we were saying before, if I go down that avenue with them, I'm more likely to have success.
Yeah, I've done some past life regressions with people. It wasn't for medical reasons. They were just curious. They were like, I'd love to know if I've lived a past life. And
who wouldn't? Yeah.
And I would describe it as limited success. And I think that's because everyone wants to suddenly, like it's a film, relive being in Egypt or something.
Yeah, they all want to be Cleopatra or Napoleon or, Jesus or something. Yeah.
Yeah, do you know what I mean? Or they want to visualize themselves down the Nile. Do you know what I mean? Or something like that. And you're just like... Yeah, I don't think that's quite how films make it look like that's what past life regression will do. That's not my personal experience, and I've done timeline therapies as well under a guy called Vinny Shorman who taught me, who I trained under for hypnosis. I've done his timeline therapy and stuff.
Wow,
and I genuinely found that fascinating. And some of the people that I were on it with had some really big insights. The only insight I had that stood out as an emotional blockage is, and it's really random, but there was this girl that I was kind of like a girlfriend when I was like 9 or 10 years old, and when we'd got to we must have been 10, because in the UK when you hit your 11th year is when you start that's like secondary school, which I think is your equivalent of high school.
Yeah,
and we went to different schools, completely different schools, because I was Catholic, so I went to a Catholic school in another town. And then like a year later or something, I bumped into some guy that knew both of us, and he told me this girl had been telling everyone I couldn't kiss. And and when I relived that moment as a 40-something-year-old man, I experienced this 11-year-old boy feeling really humiliated.
Yeah.
And it was really weird, because as a 40-something-year-old male, when I relived like this, my 11-year-old version of myself, it was just like, you're 11 years old, nobody knows how to kiss. You don't know how to kiss until you're an adult.
That's crushing to you at that point.
But it was. I remember what I re-experienced, but objectively from a distance, was how humiliated I felt as an 11-year-old, because this girl had been running around telling everyone that I couldn't kiss properly and I didn't know how to kiss. But as an adult, I was able to look at that and say, well, firstly, until you get into a proper sexual relationship, you've no idea how to kiss.
Yeah.
That's when you'll learn how to kiss. So don't worry about that one. The other thing that I was able to objectively do was like, you don't know that he was telling the truth. You have no context to whether you weren't there. You don't know whether he actually heard it firsthand. You have no evidence of any of it other than his word. But that 11-year-old version of me was crushed and absolutely humiliated. And I wasn't aware. And it wasn't until I'd relived that moment that I remembered this girl was even in my life. I mean, I just like, if you'd have asked me,
because it's a passing thing, but it's so interesting, and I think that's like even if we talk a little bit more straight-laced psychology, that's the underlying thing. It was a perceived trauma, right? It doesn't even have to be like it's something you would laugh off as an adult, but
of course
when you're that age, it's such a big part of your identity and who you are that like, oh, somebody has now attacked that.
Because as an adult, that's the sort of thing that you joke about when you've had bad kissing experiences because of circumstances, like maybe you drank or you went into kiss and they weren't ready and you bit their nose or something like that. Do you know what I mean? They're things you laugh about, and sometimes it's how you end up married to somebody, because you end up with this hilarious experience.
Some weird thing that would never happen, in a movie or anything like that. Yeah.
Sometimes the best times you've ever kissed is when it was an accident.
Yeah.
But as a kid, you've got no experience of that. And that's what I said. I was objectively, as an adult, looking above this conversation between this kid Stephen and myself, and I was just like, you couldn't possibly have known how to kiss. You just didn't have the life experience. You were far too young to understand any of what you and I have just discussed. But I just remember how humiliated I felt. And I was like, wow, I didn't realise. And like I said, it was a memory I'd completely forgotten about, and a girl that basically was my girlfriend during the summer holidays, who I'd forgotten.
Yeah, it wasn't a long-term relationship. No, it wasn't anything
serious. I'd forgotten
serious.
she'd even existed, you know.
Yeah.
But it had a huge impact on me.
Yeah.
So it's, you know, it's a fascinating subject, and I'm always curious, like just how, like you said, just in terms of values and principles, how aligned different practices are.
Yeah.
But we're fighting the money machine, it would appear.
Yeah. Oh, definitely.
Yeah. But just lastly, because I need to let you go, and because we've killed an hour already.
Man, like I'd talk to you all day, and I'm going to ask you right now if you'll be on our podcast, because I think my friend Matt will absolutely love this conversation. We haven't discussed NLP or hypnosis before. I'd love to do that with you on, and even spend another hour doing it.
Yeah,
but yeah.
We will go through my diary and we'll look it up before when we stop this. But just randomly, I like to ask everybody a random question. And it is roughly the same random question, and it's not related to anything we do.
Great.
And it's actually, I like to expose my curiosity of people. Mm-hmm. Right. So using your imagination, I want you to imagine you can go anywhere in the world at any time. Mm-hmm. So you travel through history, wherever you want to go. Where would you go? Why would you go there? What car would you drive? And what music would you be listening to?
Oh my God. You're giving me a lot of freedom here.
Yeah.
I would probably go forward in time. I think we're a lot of stuff we talk about on our podcast is AI and where healthcare is going fast. It wouldn't even have to be that far. I'd like to see 10 years in the future. I don't even need to leave where I'm at. I would like to have reliable high-speed public transportation rather than having to have a car. I abhor driving. I think it brings out some of the worst of us, and we talked quite a bit about stress, and I believe that is a big stressor for most Americans, especially when you're sitting in traffic. That definitely ratchets you up to an 8 or a 9 before you even get to work. And I just want to see if we actually solve the problems that we're well aware of. I don't want to turn this into a debate on fascism, but I'm very afraid that we might end up down that road too. But just to see where we end up, even a decade down the road, because I don't think we'll recognize life. I mean, growing up, did you ever think you'd have a cell phone that could?
No. I've discussed this on my podcasts lots of times. If I could freeze time in 1989 and put it on a loop, I would. Yeah. There's a certain amount of freedom in there that you didn't know everything. That you didn't have to worry about everything. I'll even permit going up to 1999. But as much as I appreciate the internet, because look, the time that you and I have had this space that's been created, I really appreciate that. Mm-hmm. I really do. And that's because of the internet.
Yeah, and technology, yeah.
But life wasn't easier before 1999, but it was a lot simpler. Yeah. And we hadn't experienced the unhappiness that we can experience today. If somebody had an issue with me in 1988 or 1992, 94, unless I'd had a verbal confrontation with them, I wouldn't know you thought I was a dickhead.
Yeah.
And you wouldn't care to tell me because you're not going to see me. Whereas now some random bloke in Baltimore can watch this podcast and just write some abusive bullshit because he doesn't like the look of you and I. He doesn't like the fact that, wow, these two guys look like they're passionate about something. Fucking pedophiles.
Let me shit all over it. Yeah.
But then there's a possibility someone else will listen to this and it will take them down a path of their own discovery. Maybe you and I will get to meet them. Maybe we've inspired somebody to do something. So I don't like to shit on something that can have so many positives, but God, do I miss the 80s.
Well, yeah. I mean, you know, and even if somebody was out there saying stuff about you, what do they know? 10 people, 20 people?
Yeah. You know? You know what I mean? And and that I miss, you know, and like you say, we've gone down a road, like you say, you know, politics is a big thing for everybody at the moment. Yeah. And the one thing, and you have it in your country, we have it in our country, there is this tribalism around who you should or shouldn't vote for. And it has always existed, but people haven't been able to unite the way they do now. And it's beyond recourse. It
is. And some of it's irrational where, look, this is the party. These are the lines. Even if I don't agree with that, I'm going to dig my heels in. And you might say, oh, I like this policy and not that one. So, but I can't look over there, you know, and it's very upsetting.
I can look at politicians in this country and I can have conversations with people and I'll say, oh, what policies do you like? I'll never vote for that person. It's not even the question I asked you.
Well, yeah, you know, I knew we were in trouble when the big question was, who would you rather have a beer with?
Yeah.
None of them. I want them to do their fucking job.
But that's it's like, it's, to me, it's not rocket science. Hang on.
Yeah.
I'm going to say thank you. We're going to end the podcast or the recording.
Let's do that.
And then you and I are going to have a good old.
Well, I actually, believe it or not, I got to hop on another podcast in about 15 minutes.
Right. Well, actually, then I will thank you for your time, and it has been absolutely great. And you will see me soon, hopefully, on your podcast. So thank you very much.
Yeah, great, excellent.
Well, there you go. That was Tom. I hope you enjoyed it. I hope it gave you pause for thought. I loved it. It's been a great week for talking to people about the way we think, the way we are, who we are, and how we conduct ourselves mentally, physically, and just, you know, our place in the everyday world. There are many of us right now that feel that maybe we're a bit lost. And if nothing else, maybe just conversations can bring us some comfort. So thank you for listening. Thank you for watching. Thank you for the support. And as always, wherever you are, whatever you believe, wherever you are from, please take care and be blessed. Thank you.